Thanks everybody for coming. Today is my pleasure to speak to you as to how AI is an integral part of the solutions that Carestream delivers to empower patients and partners alike. Together we're going to take a journey that starts well before any images, any X-ray leaves a source. And whether DR or ICU or bedside, automation can help standardize and simplify workflows to reduce retakes and increase quality. AI further helps in increasing leading an exceptional quality by optimizing all aspects of image formations, in particular with those significant dose reductions as well as noise reductions. And finally, even before images are ready to be reviewed, AI pre-processing affords an enhancement further enhancement leading to better interpretability and clinical diagnosis. Amongst the many locations where X-ray are acquired, we're going to begin our story today in a DR room. As you might have experienced yourself, having an X-ray, hundreds of thousands of patients undergo X-ray imaging worldwide daily. A typical workflow for X-ray includes giving guidance to the patients, positioning the equipment, providing feedback to the patient and adjusting and doing some dose management, as well as reviewing the result to assess the quality and performing any corrections. In so many steps, there are many factors that can lead to poor image quality. However, by introducing intelligent and AI, we can improve the standardization and automations of repetitive tasks, automate the workflow, handling conditions that in cases of infections, and then with imaging intelligence, review the images automatically afterwards, and focus on performing consistent imaging for longitudinal data comparison, patient comparisons. So in the DR workflow, in the smart DR room, there are many features available at Carestream. I will be discussing a few of them. In particular, I'll be discussing with video. Video assist can improve providing guidance. Others, such as smart auto positioning, can automatically adjust the equipment to suit the patient. In position management, the radiographer, after they have left the room, can provide guidance to the patient to adjust their pose. And in the audio bidirectional audio feedback, that communication can take place. At the same time, by using AI, we can address smart collimations by allowing the blade of the collimators to adapt to the anatomy being imaged, and with smart positioning, automatically detect if the pose of the patient is not conforming to the traditional pose suitable for optimal image acquisitions. With smart technique, adjusting the exposure to fit the body habitus. And finally, post-acquisition, validate the image quality that has been acquired to see if all the components, all the anatomy was imaged, as well as apply any suitable adjustments. Next, I will focus on one of these examples to highlight how AI pervades the solution management that we are providing. And of course, this affects automations and image quality. So, smart positioning. If we're thinking of images being acquired and then providing feedback to the radiographer that's sitting in the other room, there are many subtle adjustments that can have a dramatic impact in the image quality. And so automating this process makes a lot of sense if you can imagine going back and forth and adjusting the patient who can then move again. So how do we do that? So we're doing that by using an RGB image, which is then processed by an inference engine that yields a joint map. The joint map is then combined with a depth map to generate a real-time 3D joint map. This real-time 3D joint map is then combined and analyzed and processed together with a canonical pose for the particular study in question. And pose assessment can then be determined and convey that information back to the radiographer. The radiographer, upon receiving this information, may decide that some of these adjustment warrants a change and a feedback to the patient. So, the next step in our journey takes us to AI capabilities that optimize image acquisition by canceling noise, increasing signal-to-noise ratio, and affording a significant dose reduction. Let's see how we do that. So an original image is processed through a neural net, deep learning neural net, which performs a prediction of the noise in the image. The noise in the image is then subtracted from the original image to yield a noise-reduced image. This neural net was trained using 1 million of pair patches over 5 detectors in combination with empirical noise modeling. And it was validated over a large set of cases. Let's look at an example of this, the very same example that I illustrated before. On the left-hand side, we have an original image, and on the right, the same patient, pediatric patient, with after noise reduction and cancellations. But noise reduction is also, this noise reduction is different from conventional noise suppressions in the fact that whilst reduces the noise, it's able to preserve the very fine details. And you can have an appreciation from this by looking at this abdominal stent. You can see not only more clearly the mesh, but also the reduced noise. This is really intent to highlight the capability of this functionality. But as I mentioned, noise cancellation is also a trade-off of reducing noise or lowering dose. As we know, dose reduction augment noise. So in this case, what you see here are 2 images, one of which has 50% of the original dose. Can you tell which one? Okay, hint. This is the one on the right. The one on the right affords very acute details. Now, anybody in the audience will say, well, we're looking at a foot, dose reduction is not that critical. However, if you think about the pediatric space, where a reduction of 50% in those can be dramatically significant. And let me give you another example of how smart noise cancellation can be combined with smart grid. There are synergies between the 2 capabilities that can afford not only dose reductions, noise reductions, but also optimization and reduction of the scattering. So sequentially applying the 2, we can see here, we can get a really good appreciation of how the original image was actually significantly, underwent a significant improvement in noise reductions, whilst the preservation of the details of the bone on the right. Image intelligence and AI features pervade and include a variety of algorithms aimed at suppressing and enhancing anatomical structure, such as in bone suppressions, increasing the discriminability of clinical conditions, such as in pneumothorax, and enhancing the visibility of indwelling devices, such as line and tubes. In the final step of this journey, I will talk about the our bone suppression solutions. So, as you well know, bones are a source of woes when imaging in X-ray. They are obstructing, they introduce noise. And so the solution that we have introduced and is available as a product takes an original image as the one above and undergoes a suppression by removing the posterior ribs as well as the clavicle, and yields an enhanced image, much more interpretable. How do we do that? There is a first phase that undergoes with lung segmentation. This is then followed by a subsequent detection of ribs and clavicle and edge detections of the same. These edge detections from these areas are used for bone profile estimation and suppressions, and finally an enhancement so that the patent image, the resulting image, is not only suppressed anatomically from this feature, but is further enhanced. And here is the example that I just illustrate. You can really appreciate here the difference, the result of applying this algorithm. So here is another example. This example really illustrates, on the left, this is an NLST, a National Lung Screening Study. And this is a case where there was an anomaly that was missed. And you can see on the right-hand side, following bone suppression, that this anatomy, this nodule is much more visible. And here is a close-up of the same. And you can really appreciate the benefit of removing the occluding part. So today, I've talked to you about how automation and standardization in the ER room, ICU, and bedside can reduce retakes and improve image quality. I've also reviewed how exceptional image quality can be obtained during acquisitions as part of noise suppressions and smart grids. And finally, I presented how diagnostically excellent images can be made available to foster increase interpretability and make radiologists more confident, more accurate, and have better patient management. I want to conclude by acknowledging in these three products that I have highlighted the clinical collaborators that help us evaluating the many studies that have provided the confidence in the clinical evidence, and as well the many Carestream employees that have dedicated to make these ideas and innovation a reality that is used everywhere. I want to encourage you to come and visit us in our north, on the North Hall on booth 6750. And thank you for your participation today.